Hi, you guys. Okay, this is so spontaneous and random, but I'm kind of just testing something out. So I just want to go live on YouTube because I'm used to doing live stream on Instagram and sometimes TikTok, but I wanted to do a live on YouTube to check in with you guys. I didn't announce that I was going to be doing this. So if you just happen to like hop on, that will be fun. But if not, no worries at all. And I think that this is a way to be interactive also and to just see what questions you guys have, what you guys want to talk about, what you want to hear about. And I think if you guys submit your questions, I could just see in real time like I do when I do my IG lives. So the lighting is suboptimal. It's not perfect. I'm literally in my gross workout clothes and all sweaty, just back from the gym. It's my day off. I'm not in the office seeing patients, but I just wanted to do unfiltered, authentic, just you and me asking questions and doing this live. So if you guys aren't aware, I'm doing a skincare giveaway. It's actually my first YouTube skincare giveaway, and it's many amazing medical grade treatments. So all the products that I love by Skin Better Science, by Zeo Skin Health, Elastin, Color Science. I'm even putting some Helio Care in that in the giveaway, and my products from my line MD Air. So all the SKUs from MD Air as well. So the lucky winner who ends up getting this will be announced next week. But in order to enter the giveaway, the main thing is to subscribe to my YouTube channel because I'm being more active on YouTube now by dropping content every Sunday on different, topics in dermatology and cosmetic dermatology, and also doing my YouTube shorts, just like I do on my Instagram stories. So subscribe to this channel if you haven't already. Hit the notification bell to get notifications when new info drops. And then also, I'll include a link probably on this live if I can upload it. And there's a link to sign up for the email list. So when we drop new products from the skincare line or something new happens, you guys get email notifications. So hopefully you guys will be able to do that as well. So it is a great giveaway. I love doing giveaways, just like I love doing lives, because I feel like I'm so limited with what I can do to give back to you and to show my appreciation for you guys and for our YouTube family. And this is one thing that I can do to give back to you guys. Giveaways, YouTube lives, answering your questions, free derm consults online. So hopefully this will be helpful for you guys. And I'll do many more giveaways too. This is the first of many more to come. So if you don't win this one, hopefully you'll win the next one. So somebody asked, what is your favorite filler for cheeks? Okay, so derm questions are always fun. So it depends on the area of the cheek. So the thing with filler, I'm not a big filler person either because I'm a laser and device girl, but filler definitely has its place in the whole aesthetic continuum and comprehensive treatments. So, we have lasers, we have energy-based devices, we have peels, we have topicals like skincare, what we do at home. There's fillers, Botox, neuromodulators, things of that nature. But for the cheeks, I love Voluma for the cheekbone contour. I also love Restylane Lift. I also love RHA4. There's different fillers that are engineered to perform differently in different areas of the face, depending on the injection plane that you're injecting them to, and also for the goal that you're trying to accomplish. So say somebody in their 20s or 30s is going to have a different goal that they're trying to accomplish than maybe somebody in their 40s or 50s, or maybe two people who are the same age that have variant anatomy, different bone structure, different, aging processes. They're going to have different fillers. So I've been doing this a long time, and it just comes from experience and really understanding these products really well on a molecular level. They're cross-linking, they're G prime, they're, how they manipulate themselves into the tissue, how long they hold, the injection planes that they have to be injected into to minimize complications like migration and things like that. So it just depends on each individual patient basis and what goal we're trying to achieve and what we're trying to fix in the cheeks. If we're trying to accentuate the cheekbone, if we're trying to achieve a little bit of lift, if we're trying to reverse some mid-face hollowing. So right here in the mid-face, Sculptra and I think it would probably be Radius are my favorites because they're biostimulatory fillers, and biostim fillers do best in this mid-face area. In the cheekbone area, usually fillers with a higher G prime like Voluma RHA4 or contour or wrestle and lift do really, really well there too. Now, if you're going all the way down to the bone, you'd want to use something like Voluma. If you want to go more superficially, just sub-Q, then you would want to use something like contour. So it's a very complex answer to your simple question, which I feel bad for. Hopefully I won't confuse you anymore, but it's just there's a method to our madness. And I always, think it's important that a physician's office or a med spa or wherever you're getting your injections has all of the fillers available. It's not like, oh, we have a package deal with this company, say Allergan, and we only do these fillers, Voluma, Volbella, Velour, or we only work with Galderma, or we only work with RHAs, because that's how you tell if an office is legit by, oh, we have everything to choose from. And the provider is like an artist with having different paintbrushes and different types of paint to customize each treatment for each individual patient, which is very customizable, which gives the best outcomes. You don't want to do the same filler on every patient, and you don't want to do the same filler in the lips that you're doing in the tear troughs that you're doing in the cheeks. So that's where the level of expertise and the next level services come in. So, every provider is going to have their favorite based on years of experience and feedback from patients and, studies and, progress and innovation and marketing these products. But for cheeks, I have several ones that are my favorite, and it just would depend on the patient, his or her age, and what they're trying to achieve and what dermal plane I'm going to be injecting in. Periosteal, superficial, mid dermis, it just depends. So hopefully that answers your question and provides a little bit of insight. Oh gosh, you guys have so many amazing questions. Hopefully I can get to all of these. Okay, what are your thoughts on PDT light therapy for facial flushing? So PDT is, photodynamic therapy. Usually PDT is used more in medical dermatology. So PDT is when you apply aminolevulinic acid, which is basically a photosensitizer, and then you sit under a light. And what it's really great for is for targeting precancers, in patients who are predisposed to skin cancer or precancerous lesions, which we call in dermatology actinic keratoses. So you do PDT for patients who are trying to minimize their incidence of skin cancer, definitely all day long. And as a Mohs surgeon, which I did a fellowship in Mohs micrographic surgery, which I don't really do skin cancer surgery anymore because my cosmetic practice keeps me pretty busy, but we would do PDT on patients a lot of the times to keep their incidence of skin cancer down. Now, as a cosmetic treatment for age spots and melasma and skin tightening and rejuvenation, it wouldn't be my first choice. It's more of like a medical grade for anti-skin cancer treatments. But for facial flushing, it wouldn't be my go-to. It's kind of like a not very elegant, I hate saying a cheaper alternative to a laser, but that's pretty much what it is. Nothing really can touch the elegance of a laser and the targeted therapy with the customizable outcomes like a V-beam laser would for facial flushing, or an XLV or a KTP. IPL is kind of a wastebasket, jack of all trades, master of none, cheap alternative to a laser. You'll find them on every street corner in Orange County at every med spa, but it's just that. It's a med spa level IPL broadband light, which is not truly a laser, but that can help with facial flushing. But talking about the best treatments for facial flushing, it would be a 595 nanometer chromophore seeking wavelength laser at V-beam, or like a 595 532 KTP or XLV. So I try not to get too scientific, but I know you guys like it when I get scientific too. So hopefully that wasn't too technical or physics oriented for you guys. But facial flushing, I'm usually best with laser, and I wouldn't do PTT for facial flushing, although I would do it for diminishing actinic keratoses or precancerous lesions or patients with a history of skin cancer. Okay. Ellie, thank you for the live. You're so welcome. I love doing lives with you. It's been a minute since I've done one on YouTube, so I wanted to hop back on here. And since I have the day off and I'm not in the office, I wanted to connect with you guys. Okay, so somebody else asked, is your new cleanser safe for type 1 rosacea, sensitive skin? I love all your products. So thank you so much for loving the products. I love them too. I'm obsessed, and I really just engineered them for my patients so that you guys had a great option with most innovative technology, and you didn't have to wait for advances in technology and discoveries in dermatology to hit the mainstream skincare industry. So that was my incentive, to basically have products that were highly innovative and just pure, best high quality ingredients with next level results that, will definitely manifest themselves within days of use because of the difference. So for the cleanser, it will be definitely safe for type 1 rosacea skin and sensitive skin altogether. So for you guys, if I've never really announced it or really even talked about the evolution of the skincare line, I probably should do a whole YouTube video on that. But I basically hand selected a personal chemist, a person that is well respected and very knowledgeable, well beyond his years and expertise, and who really works hand in hand with me and is very receptive to, all the crazy requests that I make in my OCD type A behavior, trying to get these skincare, products perfect. Having only the highest grade medical grade active ingredients that are sometimes very hard to source and very hard to get. And he doesn't give up on me when I say, no, we have to have this active ingredient. There's no alternative. It has to be this one. And it is the most expensive and it is hard to source, but I know that you can get it from me. And he's amazing. And we do that back and forth. I'm always sending him literature the minute it's like hot off the press, randomized controlled trials, studies, things that, I receive just being on these medical derm societies and cosmetic derm societies. I send him papers and we just formulate and just bounce ideas off one another. He's amazing at that. So we wanted to have a cleanser that would be at a specific pH, and it took years to perfect it. It's come to fruition now. I'm so excited that it's going to drop in the next couple weeks, hopefully before Thanksgiving. That's my goal. But to have a specific pH of 5.5 so it doesn't disrupt the acid mantle, it cleanses the skin without stripping the skin of its natural moisturization factors, without disrupting the barrier, without disrupting the acid mantle. pH of 5.5, hydrophilic, hydrophobic ratio is perfection, so that it cleanses the skin, removes impurities and toxins, but it doesn't compromise the skin barrier or natural moisturization factors. So that was like so important to me. And the fact that now most dermatologists are pushing double cleanse, triple cleanse, oil-based, water-based, and then you have to break up the makeup and then you have to clean it off. It just is getting exhausting. And even me, I would have like a 3-step cleansing system. So that's what took so long to formulate this cleanser, because I had to hit all those bullet points. Otherwise, it wouldn't be worth making a cleanser, because other cleansers exist that you have to use 3 steps, or that, are kind of balanced in a certain way where you have to use 2 or 3 of them in order to keep the pH unaffected. But I wanted to have one cleanser, gentle, clean, easy on the skin. And he basically is using all plant-based surfactants. So nothing, everything. I think that most of the surfactants are very hard to source, but they come from coconut extracts and are plant-based surfactants. So that makes it really great for sensitive skin, especially if you're prone to eczematous dermatitis, seborrheic dermatitis, rosacea, perioral facial dermatitis, things of that nature. So it's good for all my sensitive beauties too. And my skin's sensitive as well. I struggle with acne, rosacea, melasma, all the things, and my skin tolerates it really well. And it has natural fruit-based extracts in it too. The AHAs and BHAs are derived from multiple, pineapple, papaya, pomegranate, and some more esoteric, very hard to source fruit extracts, which are amazing. But I literally heard from our scientific lectures within the derm community, and I'm like, okay, we need these in our cleanser. So I'm excited for that to drop, and I can't wait to explain more of that to you. But you guys are probably getting sick of me talking about all these scientific cleansing terms. Okay, so let me see. What is the best filler or treatment for skin sagging and chin dimpling? Okay, so chin dimpling is usually a Botox treatment. So I don't know if I can do it, but sometimes people get like a pebbly chin. And that is from a couple different reasons. Sometimes, say you have a pebbly chin in your 40s and you're like, I didn't have this in my 20s. Why is this happening? My muscles haven't changed. The dermis and the skin thins as we get older. And so things show through the skin that weren't really apparent before. So when you get this pebbling and dimpling of the chin here, it's from the mentalis muscle pulling that chin skin over the muscle. And so, derm tips for Botox. Now, the pebbling can happen over the chin here, but the Botox has to be very precise. And this is what we learn in like advanced fellowship training. You can't just, Botox around here. I've had providers at other offices drop their patients' chin and drop their lips and give them asymmetric smiles and make them look like that a stroke, because they're not injecting the Botox in the right area. They're just saying, oh, the chin's dimpling here. Let's just put a little Botox here and here and here. You have to do it right at the insertion point of the mentalis. And it's like 2-2-1-1. And this is, it's hard to give medical information over YouTube because I don't want to be held accountable. This is by no means a residency training course or a Botox training course, but the mistake that providers often make is they're injecting Botox in inappropriate areas. So you want to target the mentalis muscle right here. And by doing just 5 units of Botox per precisely and very, meticulously in this area, it will smooth out the chin. Now, if you still have kind of textural regularities in the chin after Botox, you could do a little bit of filler in that area, a very low G prime area, very watery filler, if you will, to kind of smooth out that contour. And that really works really well. So you could use like Vobella, Bellotero, and there's actually a new filler that's going to be coming out by Allergan in November. Actually, I'm very honored to be one of very few physicians that are going to have dibs, first glance, and first experience with this filler. It's called Skin Vive, and it's going to be a textural filler. And the funny thing is that I remember like 6 years ago, I was at an ad board meeting for Allergan. I was very honored to be there because I was just straight out of fellowship, still very young. And I was like, okay, they asked us like, what do you providers wish you had in your filler armamentarium? And we're all like, I wish we had a very superficial filler that we can inject into the superficial aspect of the skin that's a biostimulatory filler that would kind of do what a laser would do with respect to the texture of the skin, not just, helping nasolabial folds or making lips plumper or things that fillers typically do, but to help with the texture of the skin. And so Skin Vive, I think, was born, and that's one of those fillers that is going to be really helpful for textural regularities on the chin. But that's not launched yet. Hopefully that's coming in November. I know it's like kind of dark. I need to optimize my lighting here. Sorry, guys. I'd like no filter, crazy shitty lighting. I'm sorry. But I wanted to just do this live with you and get it out there. And then the other alternative that you can do for chin is laser resurfacing. So like a Fraxel, ablative or non-ablative laser. Usually I stick with non-ablative lasers because the results are usually pretty equivocal to ablative lasers, but it's less downtime, less discomfort during the procedure, and less aftercare. And my patients really don't like to have a lot of downtime, and they want to get back to their very busy social schedules and, don't want to have to deal with doing vinegar soaks and things of that nature. So we do a lot of non-ablative lasers like Fraxel or even Clear and Brilliant to help the texture of the chin. So that's my chin post. I should probably write that down and make that a topic for my next YouTube video. But that's a great topic because chin, a lot of people come in not liking the way their chin looks, or they say it's textured or pebbly. And usually the pores are larger on the skin, on the chin, because there's a higher density of sebaceous glands there. So Fraxel and resurfacing help shrink those pores down as well as using some type of exfoliating, skincare product, whether it's a mechanical or a chemical exfoliant too. So hopefully that answers your questions with chin aesthetics. Okay, so somebody asked, let's see. Oh, I love your skincare line. Thank you so much. I love that you love it. That means everything to me. Those skincare products are my babies, and I engineered them just specifically for you guys and for me and my loved ones and mom and you too. So what is the best eye cream or creams to treat wrinkles for thinning skin? Thank you for all of your time and sharing your knowledge. Well, of course, I'm going to be biased to my MD Air ECM eye serum because that I felt that eye serums was one of the things that was really lacking in the skincare industry. And one of the impetus for me to start my own skin line is when I would go to these meetings, I would hear these amazing scientists talk about all these breakthroughs and discoveries. And when I raised my hand and asked how long until they're mainstream into the skincare products that we're giving our patients, they're like, oh, there's like a 5 to 7 year lag time before the skincare industries catch on. And I'm like, okay, well, I'm going to cut that because we need these new active ingredients upregulating all these pathways that you guys are discovering yesterday in our skincare line, in our skincare products that we're giving our patients. So that was the impetus. And a good eye serum was hard for me to find. I really loved the Elastin Eye Restorative Complex with the Trihex technology. Amazing eye serum. It's still available now. Elastin got bought out by Galderma, and then Skin Better Science, which is another favorite of mine, got bought out by L'Oreal. So I'm hoping that they can maintain the integrity of their products. But that's another reason why I wanted my own line, because I'll be protected from some big marketing company, kind of engulfing me and having their hands and getting, maybe less expensive active ingredients or cutting costs with something or another. I just want to keep it pure and just me and my scientists making these products for you guys. But another good eye serum, gosh, let me see if I can think of any. Honestly, that's why I wanted to engineer my own. I really can't think of any other ones. I know that Skin Better Science has IMAX, but there's a retinol in that was causing some irritation and hyperpigmentation in some of my patients, just being totally transparent. But I would have to say Elastin's Eye Restorative Complex or my ECM eye serum. ECM just stands for extracellular matrix because it's the extracellular matrix proteins that give skin that beautiful smooth contour, because the collagen and the elastin in that delicate eyelid skin, has to be upregulated to keep that area nice and smooth over time. And then caffeine, niacinamide, polypodium glucatomas, topical melatonin, all these active ingredients that have been shown to vasoconstrict to help with dark circles and, to diminish lymphatic impedance, which basically in English means decrease under eye puffiness. I'm trying to think if there's any other under eye serums that I love. I'm sure you guys can tell me what you guys have been using as well. But those are my favorites. I know Color Science has some under eye hydrogel masks that are really helpful too. And unlike most hydrogel masks that take the fluid out of the under eye area, it puts it back in because you have to use a serum first and put the eye mask on top of it. So that's another good one if I had to give my recommendations. But I love Zeo Skin Health, but they don't have a great eye serum. So I hate to say that. And Dr. Obagi was like one of my mentors. So but again, I'm transparent and they have a lot of other amazing products, but eye serum is not one of them, to be honest. Okay, then. Oh, I love these. Can you talk about PRP and PRF filler and treatments? So PRP is platelet-rich plasma, and PRF is platelet-rich fibrin. I think that's what it is. It's plasma-rich fibrin or fibrin in the plasma. PRP and PRF all have fibrin and platelets and growth factors in serum that is basically taken out of your own blood, spun down in a centrifuge, and re-injected into the face. So this is the thing with PRP and PRF. Back when it was first launched, I was so excited about it, just like I am about this microporing device coming out. But I'm sure that microporing, this new development that's coming out, it's about to drop soon. You guys, I get on tangents. I have like ADD. I have to stay on course. I get excited when something new comes out, and I'm always the first to try it and comment on it. When PRP and PRF were a new development, I integrated it into my practice, was treating patients with it, and I just didn't see the results, and patients were always unhappy with the long-term benefits of it. PRP and PRF for the couple days following it will look good with respect to under eye hollows, acne scars, fine lines, and wrinkles. A lot of it because it's just swelling and fluid. But 6 months later, 12 months later, you're back to where you were before. And, it's a lot of money and it's a lot of time and it can be uncomfortable. And if you don't have the long-term results that are going to either keep getting better or stay improved like they are with a laser or an energy-based device, and this isn't just from looking at patients clinically. I spent decades as a Mohs surgeon looking at skin under the microscope, and I would see these changes histologically too. So that's where my vantage point is coming from. There's just no long-term patient satisfaction or physician satisfaction in the outcomes with PRP and PRF that's like statistically sound, studies and data from randomized controlled trials. Can it hurt you? I don't think so. I think it could hurt your wallet and your bank account because it's expensive. And if it's not going to be a good investment of your money or your time or, your discomfort, then I just don't think it's worth it. So that's not to say if somebody has done PRP or PRF and they noticed results that was long-standing and still present after 6 to 12 months, then by all means, more power to you. Go ahead and do that. But as a provider, it's hard for me to recommend PRP and PRF because patients are always upset when having it done on the outside. They always come back to me saying it was a waste of money. Give me a laser. I want something that works. Now, if you're talking about under eye hollows, PRP got a lot of media attention because it was a safer alternative to under eye filler. Now, I've served on the advisory board for the FDA indication for under eye filler, which we call under eye hollows filler. And if you look at the scientific data, now that's different than if you do a Google search and you look at publications that are maybe from third-party marketers who are writing these articles saying that, these treatments work. But when you look at peer-reviewed journals and in our medical community, which you don't even really get access to unless you're, board certified and members of the society, which is why when I get this information, I try to give it directly to you guys. There's no data saying that it's efficacious or has any anti-aging benefits. Part of the reason why under eye PRF or PRP was it doesn't work is because this is plasma. Plasma likes to be intravascular inside the blood vessels. That's where it came from. That's where it's going to go to. So when you temporarily put PRP under the eyes, it's going to stick around and cause a little bit of swelling under eyes to make it look better. So the patient, the providers will post a before and after, like an hour after the treatment, but bring the patient back 6 months later and see the difference. Like you would a Fraxel, you'll see a 6 months, difference, still 6 to 12 months, years later too. So when pure gets, injected into this area, it's going to leave the extracellular space and go into the intravascular and get carried away by the bloodstream, because PRF, PRP likes to be in the plasma, in the bloodstream. It doesn't like to be in your under eye hollows, and it's not going to stay there. So that's the 411 on that. And that's coming straight from the medical community in our academic lectures to you guys. So hopefully I'm not hurting anybody's business, but I have an obligation to be forthcoming and truthful with you guys. And in a world where there's so much marketing out there and you don't know who to trust, even dermatologists now, there may be a derm out there somewhere, promoting it, but they're maybe, having some partnership with a company that promotes it. And I get actually approached all the time by companies, asking for, paid promotions and asking me to post or even just mention their product or their technique or their whatever. And I refuse to do it. So that's why, I just stay true to that. I never have and I never will. And I just love the authenticity that I can just provide you guys with the truth. So I'm not a big fan of PRF, and I'm sorry. And and if somebody else recommends it or if somebody else has had it done and it works for you, perfect. I'm not going to stop you from doing it, but I can't recommend it based on the evidence-based literature and science behind it. So that's a very long answer to your question, but I'll totally get off on a tangent. You guys have to bring me back. Okay, let's keep moving along. There's no way I'm going to be able to get to all these questions, you guys. I'm so sorry, but I'll do a live again for you guys soon if you guys like this. And like just kind of this, I love interacting with you guys in real time. I just wish I could get to all of you. Okay, somebody asked, thank you for your dedication. Oh, I love it. It's from the heart. I'm passionate about it. I couldn't do it if I wasn't into it and loved it as much as you guys do. And thank you for being interested in skincare as much as I am. And thank you for being science nerds and loving the skincare science like I do too. I finally found my people. Okay, so let me just scroll down. Thank you. Can't wait to try your new eye serum. Oh, good. I'm so glad that you're going to try it. Somebody asked, what do I think about cool sculpting? I've actually had cool sculpting after both babies. That was the first thing I did. I did Clear and Brilliant on my face to clear my melasma, and I cool sculpted myself, and it works amazingly well. This is the problem with cool sculpting. And again, I love Allergan as a company for their neuromodulator Botox and for their portfolio for fillers. But as far as cool sculpting, I don't have a cool sculpting device in my office. And the reason why is it works well for fat reduction. However, sometimes the complications outweigh the benefit of the treatment. So you have to be a perfect candidate for cool sculpting. You have to have fat and you have to have good skin sugar, because sometimes when you decrease the fat and you have skin laxity, it's going to make the skin laxity worse, especially because in order to fit into the handpiece of the cool sculpting device, there's a suction vacuum that like sucks you into it. And when it lets go, it stretches out your skin, and then you're reducing the fat, which fat's basically like filler. So with all that filler, your skin can just hang there and look lax, especially after having babies or if you're over the age of 30. So be really, really careful. Another thing that can happen is, compensatory adipose hypertrophy, which in English means once you take fat from somewhere, you can have excess fat in another area. There's been some case reports of that. So before opening my own office 3 years ago, I actually worked in offices that had cool sculpting, and I loved it, and I would recommend it for my patients, but they would go through a very vigorous criteria like interview to make sure that they were good candidates for it, because in the wrong hands and the wrong candidate, it could have catastrophic outcomes where the benefit of the cool sculpting treatment does not outweigh the risk of the side effect which happens. So if you do have cool sculpting, try to go to a medical office instead of somewhere that's trying to sell you a package who really doesn't care if you have a bad outcome or not. I mean, I hate to say that exists, but my practice is in Newport Beach, Orange County, where there's a Medi Spa and a derm office on every corner, I feel like. And these people aren't even board certified dermatologists. They're board certified in family medicine, and they're practicing dermatology. There's actually only 500 derm residents that graduate each year. So there's a small group of us. But a lot of people can sometimes be misleading. And I feel like those are the offices that have the highest rate of complications, especially with things like cool sculpting. So just, if you're thinking about cool sculpting, make sure you go to an office who really looks at your skin, make sure that you're a candidate, and make sure that you're going to benefit from it and not have the side effects from it. Not just someone who's like in a mill trying to like pump out as many cool sculpting cases as they can, because that's when you get into trouble. So if you have good skin sugar, meaning like the elasticity is good, and and you fit into the handpiece and you have enough fat there that it's going to make a difference, I think that that's a good idea. But I just don't think it's worth the risk. I'd rather do like an sculpt where you're going to build muscle and it's going to decrease fat, and you're going to to naturally look better toned, and you're not going to have the skin laxity issue that you will with cool sculpting. And then another thing is, I remember when I was in fellowship, we did a cool sculpting on this girl on her medial thigh. She was actually young too. She was like 22 years old, and we did her medial thighs, and they didn't place the handpiece right. And she literally had this like cookie cutter, like it looked like somebody took a bite of fat out of her medial thighs. And it was hard to correct that. Then we had to use like Kybella to kind of smooth it out and even it out. But I feel like Kybella, which is a natural fat dissolving enzyme, which you inject to decrease fat, that's a better alternative sometimes in cool sculpting. So actually Kybella and Sculpt, that knocks it out of the park. And it's safe, and you're inducing your body to melt the fat. So it's a very even distributed outcome without like the ridges that you get from lipo, or the cookie cutter thing that you get from cool sculpting, or the stretching out of your skin that you get with cool sculpting. I love Kybella with Sculpt. Sculpt tones your muscles, grows your muscles, decreases the fat. Kybella is an injectable that melts the fat, but it does it in a very natural, very ill-defined borders, not just like a cookie cutter kind of imprint of the fat being taken out, because of the mechanism of action and the pharmacokinetics and the way that it works. So hopefully that answers your question. I did a recent YouTube video on Sculpt if you guys want to check that out. I think that was either last week or the week before. Okay, and then somebody asked me, what else? Oh, how do you recommend finding a qualified person in Denver? I think Joel Cohen, Cohen, is one of a world-renowned laser specialist and aesthetics physician in Denver. That's who I would recommend. And honestly, when you guys are searching providers, just don't be afraid to ask people for their credentials. You should see people in my office, and I love it. I don't trip out on it at all. I love the fact that they've done the research and they ended up in my office because they know I'm double fellowship trained in aesthetics. They know that I trained at UCLA for derm residency, which is like a top 3 program where we got a ton of cosmetics in our curriculum. If you trained in like the middle of the country where maybe aesthetics isn't as bumping as it is in like Miami or New York or LA, you're not going to have that much cosmetic experience in your derm residency. So even derm for derm, 2 board certified dermatologists can have very different exposure to cosmetic dermatology. I felt so bad for my USC colleagues who were doing more medical derm, and on the West Coast at UCLA, we were doing like tons of cosmetics, moonlighting in Beverly Hills and Santa Monica. And I hated it at the time, but now looking back, I'm like, damn, I was firing lasers and doing Botox my first day of residency. And you get 3 years of that. And then you do, 1 to 2 years of fellowship on top of that in aesthetics, and you're really highly trained. So don't be afraid to ask your provider, where did you do your derm residency? Are you board certified in dermatology? Are you board certified in something else practicing dermatology? And then also membership societies, usually physicians will post this on their website. The American Society for Dermatologic Surgery, which is the ASDS. See if they're a member of that. See if they're a member of ASLMS, which is American Society for Laser Medicine. If they're just, not really mentioning where they went to school or not really mentioning their credentials, they may have done like a 2-week course online on how to, do these procedures. So just, don't be afraid to check credentials. And most physicians who are board certified and fellowship trained will put that on their website. Like, why wouldn't we? I put that all over all my stuff all the time. And if they don't, it's probably because they don't have it. And so, just make sure that, and even if they don't have it, maybe they've been doing it a long time, look at their before and afters and make sure it's their before and afters. I have some colleagues who have found other doctors who are posting their before and afters on their websites, which is totally misleading. But we live in this era where social media is just like, these algorithms are changing and like these platforms are changing, and there's no accountability or regulation as to what people can post half the time. Facebook and Instagram care more about if you're posting something that's going to be hard to watch, like a bloody, OR procedure or something like that. But they're not really saying, this person's saying that they're board certified. We need to verify with the American Board of Dermatology if they're going to say this, and, call them out if they're not, which I think they should. But anyway, so that was another long answer to your question. Sorry, I'll talk forever, you guys. Just tell me to shut up. Okay. So, somebody asked, I appreciate all of your straightforward and honest knowledge. So helpful. Oh, you're welcome. And I love that you appreciate that. Yeah, I will always be forthcoming and, honest, because I've been doing this too long, and I just have seen too much to like not be. And I feel like you guys need somebody out there who's just going to give you the truth and honest answers. And for a long time, I wouldn't want to offend anybody or say anything negative or hurt somebody's business or hurt a company. But then at the same time, when I see patients having bad things happen to them or horrible side effects, or I see, providers that are being unethical, I feel like I need to say something. Like at the end of my career, I want to know that I've done not only made people's skin look their best, but also that I've done the right thing and like not, promote or help, the dark side. So I stay on the bright side, on the light side, which may not be the most popular side, but that's the side I'm on, guys. So thanks for joining me. All right, cool. So we said, what is the best treatment to treat deep acne scars? Boxcar scars, and I've tried Morpheus 8 peels and Pico, but not that much of a difference after 7 treatments. So that's why I'm not a microneedling Morpheus 8 fan, you guys. It's like people have to do 8 treatments and they barely see any difference, and it's expensive and it's painful. I would say go the laser route, definitely. And the reason why I'm a laser person is because I've tried everything out there, and that's the best, you guys. That's the best outcomes. It's the most customized outcomes. It's harder to find a provider who understands lasers well enough to have really specific, targeted, elegant lasers. It's a lot easier to have a Morpheus 8, which there's an on-off switch and a cookie cutter thing you do on everybody. But if you have a laser specialist who understands lasers and can customize to treat your individual acne scars with a Fraxel and with a Pico and maybe some V-beam behind it, and maybe throw in a little bit of subcision and throw in a peel, that's where you get the best outcomes. So, there's lots of different treatments for acne scars, but you had mentioned the boxcar scars, so that's the kind I'll talk about. So laser resurfacing definitely is the mainstay of therapy for acne scars. It was actually a question on my board's recertification exam I just took 2 weeks ago. Laser resurfacing also isn't like a one and done treatment, and there's some time that it takes to show the improvement. So say you need 3 treatments spaced 1 month apart. You do 1 treatment, a month later you're like, I think that might look better. But you come in for your 2nd treatment, and then for your 3rd treatment, you're like, wow, I noticed a response, because you're actually probably just getting the results of the 1st treatment manifesting themselves. Remember, you're kicking off signal transduction cascades to remodel scars, to have your fibroblast cells induce more collagen synthesis, to rid that scars of like the bound down fibroconnective tissue bands that are tethering it down. This takes time. It's not like, okay, we're done. It's not like surgery where you're in the OR and you come out and you have a new nose, or you have boobs, or you have whatever. So it takes time because you're inducing your body's own regenerative processes to resurface and remodel the scar. But that's what knocks it out of the park. That's what gives you the best outcomes that are long standing. Like when you're your 90s, you're still going to have those acne scars looking good, because your body did the work. Your body remodeled the scar, replaced it with healthy, viable collagen, elastin, ground substance, hyaluronic acid, all that stuff. And that's what gives those long-term results. So usually I say for acne scars, the mainstay of therapy, the thing you do first is laser resurfacing, and you'll get better. There's no way you won't get better, and unless you have a provider who doesn't doing the right settings or not using the right lasers or so forth. But for all intents and purposes, you all should get an improvement. Now, do you improve 30%? 50% or 80% after that first one? It just depends on your skin type. It depends on how the nature and histologic consistency of those scars. And usually you do about 3 treatments spaced 1 month apart. And then you reevaluate a couple months later, because there is a lag time between the result and the treatment. Of course, at first you're going to be swollen and everything's going to look amazing. But once that swelling goes away a week later, it takes a couple weeks to have that scar remodeling show those outcomes and show the improvement. And then at that point, usually what I do is talk about things like maybe a little Vobella to kind of pop the scar out, or subcision to kind of release the tethering bands that are tethering that skin down, or some type of chemical superficial or mid peel, or combining lasers with peels for the next round. And maybe you don't need any further treatment. So everybody's a little bit different, but that's usually the combination of therapy. TCA cross, CROSS, is another mechanism which I sometimes use for really deep pitted acne scars. And the reason why you need to do that is, say I have a model for you. Say you have the skin right here. This is like all the skin components of it. But here's the surface of the skin. Say an acne scar goes all the way down to here, and the base of the scar is down here. Lasers only go so deep. So if you need to bring the base of that scar up so that you can hit it with a laser, sometimes we'll take a cotton tipped applicator, like the pointy edge of a broken off Q-tip, and we'll dip it in trichloroacetic acid, which is TCA. And the cross is just an acronym for basically remodeling the scar. And so you dip that cotton tipped applicator pointy edge with like 100% or 90% TCA, and it brings the base of the acne scar up, and then you zap it with a laser, because the laser is not going to get to all the way down there. So that's how TCA cross comes into the treatment, kind of protocol. And it's for those deeper acne scars that won't be accessible to a laser beam anyway, because they're too deep. So, and then sometimes you have to do like a punch excision, which I rarely do, because I usually do the TCA cross instead. So there's lots of different things we can do for acne scars, but you can make them look so much better. And even V-beam laser to take the redness out has been shown in recent studies, which I could have told you V-beam helps with texture and collagen synthesis a long time ago, because people I do V-beam laser on for, I love that I do this, like I pretend I'm like lasering you, but people I used to do V-beam on for rosacea would come back with this beautiful skin. Their wrinkles would look better. Their pores would be smaller. And I could have told you 10 years ago that V-beam helps with texture, but it's just been determined. Use science and data and statistics show us that, V-beam laser is, been shown to improve texture. So now that's a known fact, but anecdotally, it's been known for a long time. But V-beam can also be really helpful with acne scars, not only with making them look less red if you have like a red change to them, but also for the texture, for the scar remodeling too. So V-beam is also a really great option as well. So hopefully that makes sense. I'll have to stop talking about lasers now. Okay, somebody said, can I use your vitamin C serum MDR on my eyelid? I'm glad you asked. The answer is no. I'll get to that in a second. Because I see a better result when I apply your eye serum and the vitamin C. Thank you for your beautiful products. Love them. So the thing is that the ECM eye serum has everything that the eyelid skin needs to stay healthy, to help with fine lines and wrinkles, under eye circles, under eye puffiness and dark circles, and all of the things that we have under eye. The vitamin C, I don't recommend putting it on your eye. I'm not a big proponent of vitamin C or retinol for your eyelid skin. It's not necessary. I feel like it can cause an irritant dermatitis, which can later cause post-inflammatory hyperpigmentation. That's a big reason why I don't like IMAX by Skin Better Science for the eye serum. Sorry, I have to say it, but I've had a lot of patients come in with dark circles under the eyes right where they're applying that eye serum because of the retinol causing post-inflammatory hyperpigmentation. And the same can go for vitamin C. I'm glad that you're getting a good response with it, but for my PSA for everybody out there, don't use the vitamin C or my RX or retinol around the eyes. Just use that on the skin around, in the face, but don't go medial to that orbital rim, this bony part of your skull right here. Everything medial to that's where the eye serum can go, and all of the other serums can go on the face, because the face skin is different than eyelid skin. There's a totally different glandular distribution and different glands in the eyelid skin than there are in the face, or sebaceous glands in the face that can handle things like vitamin C and other active ingredients that your eyelid skin simply will not. So I wouldn't put the vitamin C around your eye. Plus, it can get into your eye and cause a corneal abrasion. We don't want to do any of that. So keep the vitamin C away from your eye. I'm glad that you're loving the products, but I have to be straightforward with that. Okay, so somebody says, love your videos. Do you charge a consultation fee? Any recommendations for qualified dermatologists in New York, Long Island? We appreciate your candidness. It's overwhelming with the abundance of info. Yes, so I have a lot of great colleagues in New York. I mean, there are so many derms out there that are amazing. Dr. Anthony Rossi is one of my good friends and colleagues. He's at Sloan Kettering. Another YouTuber, Shireen Idris, who I think is amazing, just opened a practice. And Rebecca Kleinerman, who is a fellow before me, very well versed in lasers and aesthetics. I would recommend her. There's probably so many more in New York that I'm like not mentioning right now. They're probably going to be mad at me, but a lot of great board certified dermatologists and fellowship trained. You want to look for fellowship training. That's in aesthetics, especially in a competitive, area like New York. You're going to have a lot of fellowship trained dermatologists, and you want a fellowship trained aesthetic derm, especially if you're in an area where there's an abundance of dermatologists. Like you can be that picky, and it's totally fine. So yeah, I'd probably recommend Dr. Anthony Rossi. He also just launched his skin line and is a skin cancer surgeon. And I mean, he's one of these derms that's so highly trained in so many different areas of dermatology. You can't go wrong with him. So I would look him up as well. And I'm sorry if I forgot any of my other colleagues and friends in New York. Don't get mad at me. Okay. Let me take a look. Okay, so hello. Thanks for all the good and interesting info. By the way, why do the lasers are not as recommended for body and skin as they are on the face? They totally are. I just feel that, people care more about this than they do anywhere else. But I do lasers all day long on all areas of the body. I just did someone's arms yesterday. We did Fraxel for texture and brown spots. I did someone's, what did I do? She had a little scar here on her arm I did a V-beam on a little hypertrophic scar. So we do lasers on all areas of the body. It's just people usually want to invest in their face, neck, and chest, and their hands. So I do pico for brown spots on the neck and the backs of the hands as well. Like when people get brown spots right here, pico, pico, pico. What did I just say? I'm sorry if I just messed up my words, but if people have brown spots on the backs of their hands, and Pico does a great job of getting rid of those. And they could just rejuvenate the hands. Brown spots will make you look, hyperpigmentation will make you look older than you are. And even if you have flawless skin, it'll make you look, weathered or ruddy or kind of weather beaten. So we do lasers in all areas of the body all the time. So I'm excited to try your skincare. Yeah, I'm excited for you guys to try it. Again, I announced this giveaway at the beginning of this live, but you guys have to subscribe to my YouTube channel and click the link for MDR for the notifications to enter the win the giveaway. It's a good giveaway. It has all my MDR products, Skin Better, all the things. I think it's over like $2,000, maybe $3,000 worth of products. So you guys won't have to do Christmas shopping. You can give away all your skincare products. Actually, you probably want to keep them for yourself because they're all amazing. Okay, and then somebody said, oh, would Pico laser or Clear and Brilliant work for rolling acne scars? I wouldn't do Pico for rolling acne scars. Pico is more for a hyperpigmentation laser. I would definitely do Fraxel for sure. And, maybe an ablative. I don't have ablative lasers in my office because my patients don't like that downtime, but, a halo, which is a mixed non-ablative and ablative, which I also don't have a halo, but I love halo, and Fraxel as well. And again, I have no paid sponsorships with any of these laser companies, although they always ask me to do it. I want the freedom to be able to post what I want, what I like, and if the technology changes the next day, I want to jump to the new, technology if I like it. So I don't have any paid sponsorships with these lasers. And I just mentioned them because, I've been doing this a long time. And I remember during my laser fellowship, I trained with this world-renowned laser expert, Dr. Suzanne Kilmer, who's amazing. And she had this like 2-story laser institute. There were like over 100 lasers in this laser institute. I stayed there for like 2 years doing clinical trials after my fellowship was even over because I was like a kid in the candy store with all of these lasers. And I remember looking at all the rooms and which rooms were going faster than others. Like when you have a thermage and a L-therapy next to each other, the thermage room was always more busy. And like when you have a halo and a Fraxel Restore is always more busy. Patients were, and I kept that in mind. So when I opened my own practice, that's why I have the lasers I do in my office. It's not to say other devices in the same space as the lasers I have aren't as good, but kind of, because that's what I based what laser am I going to have in my office, only the best. And for lasers to make their way into my office, they had to pass a rigorous jumping through hoops worth of tests to get there. I don't know where I was going with this, but somebody asked me for a recommendation for Pico versus, I think it was Clear and Brilliant. So I would do Clear and Brilliant, the 1440 nanometer handpiece, or a Fraxel. But between Clear and Brilliant and Pico, I would do Clear and Brilliant for rolling acne scars. Rolling acne scars are like the textural scars. So scars have different morphologies, right? Acne scars could be hyperpigmented, they could be red, they could be dipped, they could be rolling, they could be ice pick, they could be boxcar. There's so many different. So is it texture? Is it pigment? Is it redness? Like it depends on what type of morphological changes you have in acne scar, which determines what type of treatment you get by a laser. And then sometimes it's combination therapy. I had this woman fly in from out of state yesterday because I customized the shit out of her. It was so good, but it's like I did Pico for the brown, I did V-Beam for the red, I did Clear and Brilliant for, her whole face, I did Fraxel for under eye, I did Thermage under. It's like to have, it's like having different keys to opening different doors. And when you open all these different doors, the results are just next level. Yet you can't compare that to like an IPL or a microneedling where you get one treatment and everybody gets the same thing. So I don't mean to drive that into the ground, but that's my take on it. So I'm going to stop it at that. But, okay. So somebody said, what would you suggest as a double cleanse? So, I am not one of these dermatologists that get on YouTube and say, you have to triple cleanse, you have to double cleanse, don't do multi-step cleansing. There's so many people that are so opinionated. I say, do what works for you. If you're somebody who does a double cleanse and you like it, go ahead and do it. But, if I have to just base, on data and what I know about the skin, I do think unless you have a cleanser that can remove the skin of impurities without and break up makeup or sunscreen and skincare products and remove dirt, oil, makeup, sebum, debris from the skin without disrupting the pH, the skin barrier, or the natural moisturization factors, like the one I'm about to draw off in like a couple weeks, which is why it took me forever to formulate it, but it's perfect now. If you don't have a cleanser that can do that, then you may have to double and triple cleanse. And with that said, sometimes there's an oil-based cleanser. Sometimes there's oil-based cleanser and water-based cleanser. Sometimes the first step is breaking up the makeup and, the grime from the day. And then the second is clearing it away. So whatever the 2 or 3 step process is, just find one that works for you. And if you don't do a double or triple cleanse, that's okay too, because you're probably using a cleanser that's doing all in one, which is not a bad thing. So I really like, up until this point, and I probably will still use it, I love the 3-step system by Zeo Skin Health. Now you have to remember Zeo Skin Health is not available to be sold online. So a lot of people online who can't sell it will say bad things about it simply because they weren't able to distribute it. So, there's that said too. Just to be honest, I got to be a voice of reason and honesty out there. So the 3-step cleansing system by Zeo Skin Health is a cleanser, which can be an exfoliating cleanser, which isn't too harsh or abrasive because there's these little jojoba beads that are spherical and they're not too abrasive. And then it's a exfoliating polish, which have these little magnesium blue crystals that kind of debride that dead strand corneum layer off the skin. And then there's toner pads, which help tone the skin, decrease sebaceous glands, and sebum activity, which is what you want. So I like that 3-step cleansing system. If people say negative things about it, it's probably because they didn't have access to it. And I mean, Zeo Skin Health does a really great job of, policing the internet, making sure that it doesn't get into the wrong hands and it can't be sold on other websites and things like that. But I remember the reason why I started jumping on the Zeo bandwagon is when I worked in an office. I was moonlighting as a fellow, and patients who we would prep for laser, who would just maybe be not using the best skincare, and just, my attending would just alone start them on the Getting Skin Ready protocol by Zeo Skin Health, the cleanser, the scrub, and the oil control. And they said, you don't even have to buy any new skincare. Just start cleaning your skin better. And I remember just using this. People would come in for their pre-op and then they'd come in for their actual treatment, and their pores would be smaller. Their skin would be all dewy and glowy. And that's not even adding any actives. That's just like kind of like leveling up their cleansing system. So I like that one. I've used it. I use it. I recommend it for most of my patients. All my patients love it. Almost every patient who comes in to see me has beautiful, flawless skin without the need for makeup, and none of them wear makeup. And they're anywhere from their 20s to their 80s, and they all have the same perfect, beautiful, dewy skin. And most of them use that protocol. So if they've been seeing me or if they followed me. And so based on that, that's why I recommend it. But if you use my cellar water, or you would do whatever, I just say do what's best for you. I do think it's important to have some type of exfoliant, whether it's mechanical or chemical. I'm not going to say you have to exfoliate every day. I do, and I recommend it for my patients. But if you want to exfoliate twice a week, there's some dermatologists out there like, you have to do it twice a week. Don't do it every day. And there's some that say you have to do it every day. If something works for one person, it may not work for another person. We all have different skin types. We all have different climates that we live in. Some people live at altitude. Some people live at sea level. Some people live in Hawaii, where the humidity is different than it is, in the mountains. So, you can't make these ultimatum blanket statements, and don't feel pressure from people who do this on social media. Like whatever works best for you is fine. And that's what you should do. And that may change if you move, or you go on vacation, or you switch up some environmental, exposure that your skin exposed to. So here I am again going off on a tangent, but I do recommend a little double cleanse, but I feel that if there's a cleanser that can do it all in one with the perfect ratio of hydrophobicity and hydrophilicity, then that's not going to be needed anymore. And so that's why I'm excited for you guys to try my cleanser. Okay, so what is the best treatment for under eye bags? I recently did a YouTube video on this. There's several different treatments for under eye bags. Now, usually bags are when you have herniation of the fat pads underneath the skin. And I want to take this opportunity to educate you guys on something. Lower lid blepharoplasty, and I don't perform this surgery because I'm not an oculoplastic surgeon. I do upper lid blepharoplasty. Those are easy. It's an in-office procedure. It takes 30 minutes. A very easy procedure for the patient to get through. The lower lid's a little bit tougher because you have to go through the eyelid, and it usually requires general anesthesia. But the old school doctors used to just suck out the fat pad, and then you look hollow under there. Like years later, that a lot of patients come to me for under eye filler because they have their fat pads removed. So if you ever have under eye bag surgery, make sure that your physician or surgeon repositions the fat pad. He doesn't just take it out. But that's if you go for surgery. I am a minimally invasive procedural dermatologist, so I recommend filler under the eyes a little bit. A little bit goes a long way, or tightening devices, Thermage or Fraxel to help tighten up the eyelid skin so that under eye bag's not as apparent. But you always want to smooth them. Oh, there's so many shadows on me. Sorry that this is like not filtered and no terrible lighting. But you always want to smooth out that eyelid cheek junction. When you lose that continuous transition because of the bags, then it looks like you're tired or you're old or you're sickly. And by doing a little bit of filler or by tightening the skin on top of it, it makes it look better. So hopefully that helps. Okay, last couple questions, guys, and then I'm going to wrap it up. Can a laser remove a raised mole? Okay, I'm going to put on my most skin cancer surgeon hat on right now and say you never want to laser a mole. So moles clinically are different than sunspots, which we call ephelids or freckles. sunspots or little brown spots are usually melanin pigment getting into the epidermis, which are made of keratinocytes. A mole, which is made up of melanocytes, pigment producing cells, are ones that you were born with, or ones that are kind of like dome-shaped papules, or ones that have a little texture to them. Moles are melanocytic neoplasms that you do not want to laser because it can increase your risk for melanoma or skin cancer. There should be no, and that's where it comes into being important to have a board certified dermatologist who's really board certified in derm. It's not some other MD who wants to, have a med spa and do Botox, because you never want a laser melanocytic lesion. And you usually, if you're going to treat something that you're really not sure clinically, if it's a mole or just a sunspot, you should biopsy it first. And this could be like matter of life and death, you guys. It could be potentially fatal. So I'm like actually getting really serious right now. You never want to laser a mole. You want to remove it by either a biopsy or, an excisional biopsy. You never want to laser a mole because it can increase your risk of skin cancer. I had a patient over the summer, actually a husband of a patient, who was told by a dermatologist that this mole was nothing on his chest. And he came in to see me, and this person couldn't have been a dermatologist who said it was nothing, because any board certified dermatologist would have known this was melanoma out the gate. I biopsied it, ended up being a melanoma. Within a couple of days, he was already having it excised. But that just goes to show you there's, some people out there pretending to be derms, but it can cause, really bad deleterious outcomes, including a life or death situation with a potentially fatal malignant neoplasm. So that's my, I don't want to get all negative and dark. I want to stay positive, but yeah, don't laser moles. Have them removed. Even if it's a little tiny punch biopsy excision, have it removed surgically, even if it's a little in-office procedure, and have a pathologist look at it under the microscope. Don't just take it off and throw it away. You have to have a board certified pathologist to look at the histology and make sure that those melanocytes aren't atypical. Even if it clinically looks benign and clinically looks like it's nothing, you can never be too sure, and you have to look at it under the microscope to rule out a pre-melanoma or a pre-skin cancer as well. Okay, that's my PSA of the day. I've done a couple of those though, I think. Okay, so I'm going to do a couple more questions. You guys have such great questions. I'm trying to get to every single one, but I also don't want this video to be, we're at 56 minutes, guys. Okay, I'm going to stop at an hour because I don't want the poor people who watch this later on. I guess you could speed it up to 2x to make it go faster, but I talk pretty fast, so sorry about that. Okay, so let me just see. Let's see. Okay, since you're a skin nerd, have you found studies about the long-term effects of lasers like 10 plus years? Absolutely, and they're always good. Decrease incidence of skin cancers, decrease incidence of pre-cancers, anti-aging effects that last for, now, of course, 10 years later, you're 10 years older, so you're going to have the aging process continue, but the effects of lasers are long-term. Not only looking at randomized controlled studies and trials, but just even seeing patients of mine who are in their 60s and look like they're 40, asking, what did you do? Because back in the day, they didn't have all the things that we have now. There wasn't, all these tightening devices and injectables, and it's always lasers. They had lasers in the 90s, and that's why they're looking so amazing now. So long-term effects of lasers are overwhelming. Their data and evidence is overwhelming in their favor. So of course, lasers, because lasers make your skin healthier, right? And healthy skin is beautiful skin. So if you don't do a Fraxel or laser to look better, do it for your skin health, because it will decrease your incidence of skin cancer and precancerous lesions. It's a shame that insurance companies don't cover Fraxel, because it's a very expensive treatment for just decreasing skin cancer. They'd rather just give you some Effudex, which is a $5 cream, and call it a day. But it should be covered by insurance, because it does decrease your incidence of precancers and skin cancers. Okay, so can you talk about M-Face? Okay, so M-Face is a new device by the same people who make M-Sculpt. So this is the info on M-Face. They actually just were in my office a couple of days ago. M-Face is to rejuvenate the face, and the company claims that it helps with minimizing the appearance of fine lines and wrinkles by increasing muscular contractions of the face, and because of the tightening device component in the platform of the device. The thing that's hard for me to understand, and most of my colleagues are having a hard time with this, is Botox is a neuromodulator that relaxes the muscles so that you're not creasing the skin and folding it and creating wrinkles. M-Face, you're doing the opposite effect of Botox, and you're making the muscles move and creasing that skin. But they say that it's counteracted by the radio frequency part of the skin tightening. It's hard to say. It is a newer device, and I always like to give the new toys on, the market, like the benefit of the doubt, but I'll let you guys know. But as far as I'm concerned, when you have, for example, I have an M-Sculpt in my office because M-Sculpt crushes it in the whole muscle building toning space. So as far as body contouring, so M-Sculpt uses high fem technology, which is high intensity focus electromagnetic radiation. Basically what it does is it's like a super contraction of your muscles. I use it on my booty. If you follow me on Instagram, I always get in trouble for posting bikini pics, but like it's grown my booty for sure. I use it on my abs, and it basically gives you these super muscular contractions. It recruits 100% of your muscle fibers. When you're in the gym doing a workout, it only recruits about 30%. So you don't get that like crazy elevation. You don't get as large of the contraction, and you don't get all that muscle hypertrophy or growth that you do with the M-Sculpt. So M-Sculpt as a device, I got an M-Sculpt and I have it in my office because in that space, it just crushes it for building muscle, reducing fat, and body contouring. It's amazing at that. So then they came out with Sculpt Neo, and that is the same Sculpt that we love, but it added a skin tightening device on top of it. So in talking to my colleagues and seeing the data and looking at the studies and what people are saying at our academic meetings in the medical community, all the buzz around it and stuff, people are saying you're better off having the best device that increases muscle, which is M-Sculpt, and then the best device that tightens skin, which would be like a Thermage or a soft wave renal therapy. Thermage, I feel, in my opinion, and most of my colleagues agree, is the best for skin tightening. So if I want to tighten somebody's abdomen, I'm not going to do an Sculpt Neo. I'm going to do Sculpt for the muscle part and Thermage for the skin tightening part. So you get the best of both in the space, right? Not one that's really good at this and kind of okay at this. I want to get the best of both. So M-Face is kind of the same thing. So it's for the face, it's skin tightening, and it is rejuvenating by increased muscle hypertrophy in the skin. But again, I'm very open. I don't just like something comes out, I'm like, no, I hate it. I definitely give it the benefit of the doubt. I'm usually more excited than most providers are. But then once I get let down or see patients being unhappy, I'm like, nope, I'm not going to, recommend it anymore. So I'll let you know. I'm a little skeptical of M-Face, but again, I'm open to hearing more about it and learning more about it. And the company can say everything they want, but until I see true hard scientific data, happy patients, colleagues really recommending it, like among our community, then I can't really recommend it. So that's my honest and true opinion. Do you like how honest I am? Okay. Can a laser remove a raised mole? We already answered that. The answer would be no. Can I use a retinaldehyde serum on my eyelids or under eyes? Even retinaldehyde, it's a vitamin A derivative. I would steer clear of the eyes from retinaldehyde. I'm trying to go faster so I can get through all these. How blessed are we to get Stephanie's knowledge and passion for free? Oh my gosh, share her channel. Yeah, you guys share my channel. If you guys can share this with, someone who may find it useful, I'm happy to share information. I could talk about this stuff all day long because I've dedicated my life to it and I enjoy it so much. And, I really, really appreciate that. I don't have that many followers on YouTube, probably because I don't do any paid sponsorships where companies pay you with subscribers pretty much. But I refuse to do that. So that's why I don't have that many followers. But I like to keep it small and intimate and free and, without any influence from, me being obligated to talk about some company's device or whatever. So it's raw, it's authentic, it's pure, it's honest, and it's based on 20 years of education and training, and it's here for you guys. So I don't actually care how many subscribers I have. It's quality, not quantity. And I'm happy that I connected with you guys. And thank you so much for that sweet comment. I really appreciate it. Okay, from upstate New York, love your videos. Oh, thank you from New York. I love you too. So is it like New Face? So going back to the M-Sculpt or M-Face to New Face. New Face is different. New Face is an at-home microcurrent treatment to help with skin tightening. I'm not a big fan of New Face either. If you guys have one and you use it and you feel good about it and you love it, and maybe there's a placebo effect from it, totally use it. I'm not going to say anything bad about New Face. I just don't think that's that effective, and I think it's expensive and it doesn't really work that well. But the difference between M-Face and New Face is microcurrent, a little bit weaker because it's an at-home treatment. I don't really think it works that well. And M-Face is electromagnetic radiation to induce muscle hypertrophy. So electromagnetic radiation, not microcurrent. So they kind of do different things. I don't think New Face actually involves the muscles as much as M-Face does. But again, just different mechanisms of action. But they both state and claim that they do the same thing. Okay, last one of the day. Doc, can you please comment about fat loss from lasers, ultrasound, and radio frequency? Yes, I can. If you don't have much facial fat, does getting repeat applications of these reduce facial fat over time? So this is the thing, and I'm going to end it with this question. So sorry if anybody types a question afterwards. See, I'm so neurotic and OCD that if I see another one pop up, I'm going to have to get to it. But I'm not going to. I'm going to end it on this because we're over 1 minute and 1 hour and 3 minutes. But I think this is a lot of useful information. I'll post this one. Hopefully it'll upload and it'll stay for those of you who miss it. But so the reduction of fat in the face with lasers, ultherapy, and thermage. So lasers and ultherapy, microfocus ultrasound, have never been shown to reduce fat in the face. The only one that really has is thermage, which is the one I happen to like the best. And I'll tell you why, because it's probably not making sense to you. Thermage back in the day, Thermage is like 20 years old. It's probably the oldest tightening device on the market. But the Thermage FLX in 2022 is much different than it was 20 years ago, whatever it was called back in the day. And I remember it was before I was even in med school. So the thing with Thermage is that we used to crank it up really. Not we, I was before my time, but they used to crank it up, and they didn't have any mechanisms within the handpiece software. I mean, the software is totally always improving. It's like saying, do you want this new phone or do you want like the iPhone? The iPhone's been around forever. Well, yeah, the iPhone 14 is a lot different than the iPhone 7 or whatever. So, the Thermage nowadays is like a totally different beast than it was 20 years ago. But back in the day, it could cause when it would go too high, when they would crank it up too high and the software didn't turn it off. Like now you can even melt fat if you wanted to. You can't crank it up high to get into a temperature territory where it's going to melt fat, because the device is so smart. It even protects you from people who are using it, who don't know what they're doing. And Medispas, I hate to claim Medispas, not Medispas, but like say that there's a non-physician office who is doing Thermage in their backyard or whatever, and they don't really understand the physics of it. They think more is better, and they crank it up and they end up melting fat. The laser platform and software won't even allow you to get to those temperatures. So when you're doing Thermage, the way Thermage works is, or any tightening device, you induce fibroblast synthesis of collagen. If you're putting heat in the form of radio frequency in the skin to stimulate and upregulate those pathways that make more collagen. If you ever look at somebody who's burned themselves, the burn scar under the microscope is chock full of collagen. That's why the scar itself is smooth and tight and almost like keloidal, like a keloid. Keloids are chock full of collagen because they had some type of injury, and your skin responds to injury by making collagen, which makes it smooth and tighter, but you don't want it too smooth and tight because then it's going to look like a scar. So Thermage adds heat below, cools the top. If you've ever had Thermage, it feels like cold and hot at the same time. That's why. It's keeping the upper level of the epidermis cool, heating down below where you want all that tightening to lift, tighten, and pull, but you don't want to change the surface of the skin, because underneath, with all that pulling and tightening, it's going to make the surface look better. But you want to do it in a very elegant, very controlled manner. And that's how Thermage works. Back in the day when the platform was more, in its early stages, like the iPhone 4 compared to the iPhone 14, back in the day, they didn't have a mechanism to turn it off. So people would like overshoot that window where you need to be. You want to be in the sweet spot where you have enough heat in the form of radio frequency delivery of energy into the skin to stimulate collagen to lift, tighten, and pull, but not up here where you're going to be getting into melting fat category. Up here, when you're this hot, you're not even stimulating collagen. All you're doing is melting fat, making people look worse. So you want to be right here. So now the platform doesn't let you leave this area unless you're in an office that has an older platform and they don't know what they're doing and they're numbing you. Then you can get fat loss, but you shouldn't be putting yourself in that position anyway. And if you're following me on YouTube, you're probably so well read and so well knowledgeable and such a skin science nerd that you would never be in that position anyway. So don't worry about that. Lasers can't melt fat. Ultherapy, microfocus ultrasound cannot melt fat. If anything, they induce the skin thickness. They make the skin thicker. They make it. And like I said again, I spent decades as a Mohs surgeon looking at skin under the microscope. And after I would clear the cancer and sew people up, I would look at people's skin based on the procedures that they'd have. And I'm like, why does this 50-year-old have 30-year-old skin? Why does this skin have so much collagen? This isn't what 50-year-old skin is supposed to look like. Why does she have so much collagen and elastin? Why are cells turning over? And I would look back in her chart and see what treatment they were doing. Thermage, using retin-A, doing all these things. And so looking at the skin in real time, it's not something I Googled or I read. I've seen it with my own eyes for decades, looking at skin under the microscope. And so Um, lasers only thicken the skin. They don't melt fat. They don't cause fat atrophy. They don't make you lose volume. So even if you have thin skin, it's actually a good thing to do. It'll thicken your skin and give it more collagen and ground substance to make it look more youthful. Therapy hasn't been shown to do that either. And Thermage is the only one that has. But again, that was back in the day when it was so early stages. And it's usually for providers who don't understand skin biology, and that's why they're saying, oh well, if heat increases collagen, let's just crank it up, because a dermatologist or somebody who understands the physics of these devices would be like, don't crank it up, then you're going to melt fat. You want to be in the sweet spot where you're stimulating collagen. And then another thing is with Thermage, I never numb my patients. If you're a patient of mine, I never numb you, and it's not uncomfortable because you're heat stacking, you're going in certain vectors, certain number of passes. Like, people who don't do it correctly will have less than desirable outcomes from Thermage, but that's because they're not following protocol. If there's 900 pulses on a handpiece, they sometimes use the same handpiece on 3 different people, so you're getting 300 pulses, not 900 pulses. And I've seen this when I go in to do trainings and stuff. I would see providers doing this, and I thought it was so unethical. I'm like, man, I can't not talk about this, but that's so unethical. And how do I not tell people that this is going on the outside? So just be careful. Go to a legit, an office where you know and you trust the providers, and that they're not cutting corners, they're not numbing you for Thermage. Because when people put numbing on for Thermage, they crank it up, and you don't, as a patient, you don't have that internal reference system to say, hey man, that is too hot, like turn it down, I can't take this. I don't numb my patients, and the minute it gets a little bit too hot, which I don't even think it rarely does, I'll turn it off and I'll go to a different spot. But if they're numb and they're just sitting there talking to me, telling me about their grandkids or their plans for the weekend, and I'm just like melting their fat, they don't have that internal mechanism to say, hey, that's too hot, turn it off. So that's how you get into trouble, using numbing cream. Old platforms are not updated, and going to people who don't know how to use these devices and end up hurting people better than they end up helping people. So on that note, I want to end on a positive. Let's do one more. Thank you for your knowledge and honesty. You're so welcome. I love you guys. I'm sorry that I look like shit right now and it's my day off, but I wanted to connect with you. What just ended up happening to be like a random spontaneous live, just so I can connect with you, ended up being an hour and 10 minutes and 41 seconds of having so much fun with you guys. And I love your questions. I love interacting with you, and I love your comments. And thank you so much for following me, and share this account with anybody who may find it useful. And hopefully we'll have our honest and true, highly educated, highly innovative, and scientific YouTube community, because it's about time one existed on YouTube. I love you guys. Thank you. Happy weekend. Let me see if I can turn this off. Okay, don't laugh at me, guys. I don't even know how to turn this off. Let's just go here. Let's stop and stream. Okay, love you guys.